before entering the room, I would check the physician's order and gather my supplies. Hi, my name is Emily. I'm a registered nursing student with NSU, and I'm going for my RN. I'm going to be part of your healthcare team today. Is that all right? All right. Could you tell me your name and date of birth? All right, perfect. And do you have any allergies? All right, perfect. So I'm going to go ahead and get you up into a good position, putting you at waist height. We're going to go ahead and we have to put in a urinary catheter today to help deal with the urinary retention. Is that okay with you? Okay, perfect. I do have an assistant today to help me as well. And we're going to go ahead and drape you and give you privacy with your curtain so that we can get this done, keep you warm, and keep you private. Alright, our first step, we're going to put you into the dorsal recumbent position. Alright, we're going to go ahead and expose you right now so that we can get down here and get this done, alright? Alright, at this point I would don clean gloves and pericure has been performed. And I will go ahead and start the sterile procedure. Taking the package out of the bag, using it as a secondary trash bag. Start off by taking my pad, putting it shiny side down. Perfect. I take my swabs out of here. Go ahead and put some lubricant in the corner. Unsheath my catheter. Attach my saline to the catheter. All right. Here we can move to the other sterile field. Can you go ahead and move the camera? From here, I'm going to hold the labia open. Take the first swab, go on the further away side, go all the way down and around my sterile field. Go on the closer side, all the way down, around my sterile field. Go down the center, going over the meatus, and again around my sterile field. Now that that is out of the way. From this point, I would get the assistance of my patient as I can get ready to put this in. I'm going to go ahead and roll around the tip in the loop. And before I put this in, I'll ask them, go ahead and bear down like you're going to void, and I'm going to push it in 2 to 3 inches until I see urine return, which at this point looks like a clear pale yellow. I will push it in another inch, holding it with the hand that was holding the labia open. I'm going to go ahead and fill up the balloon. I'm going to tug, make sure that it is secure. Disconnect the syringe. And from this point, I can let go. Can you pan it? I'm going to get the tape so that I can secure this with some slack to their leg. From here, I'm going to go ahead and connect it to the part of the bed frame that is not going to move, and make sure that there are no kinks in the hose. After hanging it, I can see that I've got about 150 mLs of the urine in there. I can go ahead and remove my work surface. Back down into a comfortable position. And while I'm getting them all set up back in their position, I'm going to go ahead and teach them that they need to keep the bag. Before that, I would take off my sterile gloves and don clean gloves to provide pericare if necessary to get off betadine from the patient and provide that. At this point, I would be teaching them that they need to keep the bag below their waist if they go anywhere, not to let it touch the floor, and to increase their fluid intake. From here, we're going to go ahead and put the bed rails back up, put this down as low as we can without the Foley bag touching the floor, and putting them into a comfortable position. I will give them their call bell, make sure that all of their belongings are within proximity, make sure they're not in any pain, and ask if they need anything else before hand hygiene and leaving the room. Thank you very much.